name's Ashley. I'm going to be your nurse. I'm going to start by washing my hands. Okay. And we're going to perform an assessment over your heart and your peripheral vascular system today, okay? Alright. So I'm going to start off by palpating your carotid artery. Got good pulse. And try this side. Okay. His carotid arteries are, I'll rate them out of 2. I cannot visibly see any jugular vein pulsations on either side. His skin color is pink. He's warm to touch. I don't see any lesions, no masses, no irritation. I do not see any heaves or lifts in his chest. I'm going to palpate your apical pulse now, okay? Okay, the apical pulse is, I would say a 1. It's not as prominent as his carotid arteries. So now and the apical pulse is in the 5th intercostal space. It is in the mitral area. So now we are going to start listening to you. Okay, I'm going to listen to the aortic area. It's in the 2nd intercostal space to the right, at the right sternal border, and this is the base of the heart. Okay, in the aortic, I do hear S1 and S2. No S3 or S4, no other abnormal heart sounds were heard. So now we're going to go to the pulmonic, which is also in the 2nd intercostal space, but at the left sternal border, and this is also the base of the heart. Again, I hear S1 and S2. No S3 or S4 is present. No other irregular heart sounds. We're going to go to Erb's point, which is in the 3rd to 5th intercostal space at the left sternal border. Okay, again, S1 and S2 is heard. No S3 or S4 or any other irregular heart rhythms. We're going to go to the tricuspid valve. It's in the 4th intercostal space at the left sternal border. Again, I heard S1, S2, no S3 or S4, or any other irregular heart rhythms. We're going to go to the mitral, which is the 5th intercostal space. It's where I listened to the apical pulse earlier, and I'm going to listen to this for a full minute. Okay. S1 and S2 is heard there also. Regular rhythm, no S3, no S4, no other irregular heart rhythms. His pulse was a 72. And that concludes the heart and neck vessels. We're going to go over to the peripheral vascular system. Would you like to put your shirt back on? I won't need it off for this one. Okay, we're going to start by just taking a look at your arms. Both arms bilaterally are pink in color. Both warm to touch. It does have a little boo-boo here. It's an abrasion. No other lesions noted. Skin's intact other than that area. Any tenderness anywhere? Okay. Okay, and gonna check your fingernails. No clubbing is present in the nails. His capillary refill is less than 2 seconds on all 10 fingers. So the warmth is warm, capillary refill. Okay, we're gonna do what's called the Allen test. Can I get you to squeeze, hold your palm up, and then make a fist just the one hand at a time. You can rest it on your leg. And I'm gonna perform a test. Okay, release it. Okay, squeeze back. And release it. Okay, we're gonna go to the other hand now. Same thing, make a fist for me. Okay, release it. Okay, make a fist. And release it. Okay. Allen test was pink coloration returned on both palms after releasing the ulnar and the radial arteries on both hands. So therefore both the ulnar and radial bilaterally are patent. Okay, so now we're going to just check your radial pulse again. Okay, I rate his radial at a 2. We're going to check your brachial now. Brachial also a 2. And your ulnar. Ulnar also a 2. Now we're going to go to the side, radial. 2. Ulnar. 2. And brachial is a 2. Okay, legs. His legs are also pink. Doesn't have much hair on his legs, but what he does have is evenly distributed. Skin is warm, no lesions. He does have some, most of his veins are flat and not very visible, but he does have some in the back side here, some varicose veins. Now I'm going to measure his calf circumference. Okay, it's about 15.5 centimeters on his right calf. And a half on the left calf. There is no swelling, no edema, no atrophy noted. I'm going to check your pedal pulses, okay? Pedal pulses are 2, feel regular. We're going to check your post-tibial pulse. It's a 2. Also a 2 on that side. And I'm just checking. No tenderness noted. No tenderness?
No.
Okay. I think I have covered everything. One more thing. Pretibial edema. I'm gonna check. I do not see any pretibial edema, so negative in that standpoint. And that concludes our assessment.